Well, we're finding the concern in the last 10 years, or as to my niche in terms of artificial joints, is that we realize now that it's not just coincidental anymore. We see a direct link to the so-called body mass of the patient, which combines height and weight, and the risk of infection. So it's now becoming a discussion of you have to lose weight before I can ethically treat you because the risk of infection is going to be so high. And so before, we didn't really have all the data that would really support it. So the conversations are hard ones to have. I always tell people it takes me a lot less time to say yes, a lot more time to say no, but I'm doing it in their interest of because the consequences of an infection of an artificial joint are catastrophic. It could lead to amputation. And sometimes people have to be spoken to in those rather blunt terms so they understand what I worry about on their behalf. You know, what I lose sleep over, because the obesity concern is such a global, such a huge problem now in the U.S. And you know, and these people need help, but you're kind of damned if you do, damned if you don't. You know, with the risk of infection, it's very difficult. They have to change the way they eat, and in some cases now with the bariatric work that's being done, as far as lap bands and so forth, that's a difficult problem also to get into. But at least the option is there for lots of people, and we are suggesting to these patients they really seriously think about that first. And we've had some degree of success. It's still relatively new, but the bariatric component of it also comes into play as far as getting them to lose weight to reduce that risk of infection. But it's such a diverse, almost exponential problem because it feeds into so many other problems of healthcare: the high blood pressure, heart, disease of the heart, the arthritis, problem. It's just exponential. So I think that if we could potentially control that, it would be just a tremendous boon to the entirety of healthcare in this country. Because right now, when we debate the issues of healthcare and how much it costs in this country, how we're going to pay for it, and there are multiple thoughts on it, of course, as we have debated over the last 5 or 10 years. Part of it has got to be addressing that problem. And also, I think the role of personal responsibility needs to be needs to be enhanced as well, because I think there is a degree of that you have to be responsible for your health. And you just can't expect to become 300 pounds and expect everyone to take care of you. The way to take care of yourself is to prevent it all. And so I think that we need to enforce that a lot more.